ഹലോ എവരി വൺ. പി എസ് സി എക്സാമൊക്കെ കഴിഞ്ഞു. അപ്പം എല്ലാവർക്കും നന്നായി എഴുതാൻ പറ്റിയെന്ന് പ്രതീക്ഷിക്കുന്നു. അപ്പോൾ പി എസ് സിയുടെ തന്നെ ആൻസർ കീ, പ്രൊഫഷണൽ ആൻസർ കീ റിലീസ്ഡ് ആയിട്ടുണ്ട്. അപ്പം അത് ബേസ്ഡ് ആയിട്ടുള്ള ഡിസ്കഷനാണ്. ഓക്കെ, ഫസ്റ്റ് ക്വസ്റ്റ്യൻ. Palla sign refers to. Palla sign is seen in acute seen in pulmonary embolism. So there is enlarged right descending pulmonary artery. So option C is the correct answer. Next, which is the most common site of dissemination in hematogenously disseminated mucormycosis? Answer is option B. It is seen in brain. Next, which is the most common pulmonary disease in HIV? Here the answer is option D. Next question. Which is the most sensitive test for the diagnosis of enteric fever? It is bone marrow culture. Option B. Next, most common organism associated with community acquired bacterial meningitis? It is Streptococcus pneumoniae. Next, a patient who received IV ceftriaxone immediately collapsed. He had wheezing and was flushed. He had a blood pressure of 80/40 mm of Hg. Which of the following is the most appropriate immediate management for this patient? Okay, the answer is epinephrine 0.5 mg 1:1000 IM. I think I have discussed this in the session. Next question. Which of the following is a contraindication for anti-snake venom administration? Here answer is none of the above. Option D. Next, a 56-year-old male non-coronary artery disease patient complains of fatigue and dyspnea while dressing. To which class of NYHA classification does this patient belongs to? NYHA class 3 is there is marked limitation of the physical activity. If the patient is comfortable at rest, then he can do only less than ordinary activity. He gets the symptoms. Okay, so here the patient has symptoms while dressing. So this is option C, class 3. Next, QT interval prolongation may be associated with which of the with the use of which of the following antimicrobials? Is macrolides, that is erythromycin. Earliest macroscopic finding in colonic Crohn's disease is aphthous ulcer. Portal vein thrombosis is an example of which type of portal hypertension? It is prehepatic, pre-sinusoidal. Next, which among the following is not a feature of tumor lysis syndrome? In tumor lysis syndrome, there is hyperkalemia, and there is hyperuricemia, and there is hyperphosphatemia. Only hypocalcium is only decreasing, all others are increasing. So here the answer is option D. There is hyperphosphatemia, not hypophosphatemia. Okay. Next, which among the following is implicated in causing aplastic crisis in patients with sickle cell anemia? Option C, parvovirus. Which of the following is false regarding the diagnosis of ARDS? ARDS is diagnosed when significant left arterial hypertension is present. This is false. Berlin criteria is used for diagnosis. This is correct. Then severity of ARDS is determined based on oxygenation. This is correct. And onset of ARDS is within 1 week of clinical result. This is correct. Next, here a 30-year-old lady developed multiple episodes of diarrhea and vomiting, and one day after taking food from hotel, she could not tolerate oral feeds either. On the third day of illness, her urinary output reduced. After admission to the hospital, her blood urea level was 200 mg per dl and her serum creatinine level was 2 mg per dl. She is said to have, so here there is a blood loss. So when there is fluid loss, in this case it is pre-renal AKI. Okay, so option C is the correct. Which among the following drug is the first one to be administered in a case of impending and early status epilepticus? It is IV lorazepam. Next question. In older adults, the inability to withstand minor stresses because of reduced functional reserve in several organ systems will be diagnosed as, this is frailty. Trust syndrome is a subset of patients under limited scleroderma. Prayer sign is elicited while evaluating a patient with diabetic mellitus. Drug patromer is used in the treatment of hyperkalemia. During ovulation, dash extrudes out with antral fluid and cumulus. It is secondary oocyte. In monozygotic twins, dichorionic placentation is seen when the division occurs before 3 days. All these are used for induction of labor except mifepristone. The incidence of sarcomatous changes in a uterine myoma is less than 0.5%. Polyhydramnios is an excess amount of amniotic fluid with amniotic fluid index more than 25. Nerve that provides sensation to the skin of suprapubic area is iliohypogastric nerve. Combination of previous cesarean and an anterior placenta increase the risk of placenta accreta. All or none period of embryogenesis regarding teratogenesis is first 2 weeks after conception. Most accurate method to date pregnancy using ultrasound is by measuring crown drum length at 7 to 14 weeks. Clue cells are seen in wet smear of bacterial vaginosis. Krukenberg tumor of the ovary arises mostly from the primary carcinoma in stomach. Area stellar reaction is seen in all of the following conditions except. There is high progesterone level in area stellar reaction. So here the answer is option D. Next, right-sided hydrothorax and ascites is seen in Meek syndrome. LNG-IUS contain 52 mg of levonorgestrel and it is released at 20 microgram. Okay. In triage, among the injuries not included in red zone is compound fracture. Okay. Note an early management of severe acute pancreatitis is ERCP. This also we have discussed. Pseudocyst is less likely to resolve spontaneously are all except acute fluid collection. Okay. This also we have discussed. I think most of the surgery questions we have discussed in the session. Treatment of flatus without respiratory failure are all except ventilation. This is also discussed. A false statement about extradural hematoma. It is can always follow major trauma. Acute subdural hematoma. False statement is lucid interval. Lucid interval is seen in extradural hematoma. In Glasgow Coma scale for head injury, motor response 4 is withdrawal flexion. Common cause of extremity compartment syndrome is fractures. False statement about axillary lymph node dissection in carcinoma breast. Level 1, 2 and 3 routinely removed. So this is the false statement. Next. Most common serious complication of varicose vein surgery is nerve injury. Not a cause of diabetic gangrene is venous insufficiency. False statement about factors associated with increased risk for carcinoma oral cavity in pre-existing lesion is smoker. Wrong statement about branchial cyst is it appears before adolescence. Option B. Pseudolipoma, it is diffuse lipoma. Okay. Which of the following is not considered as a determinant of health? Genetic engineering. Option D. The attack rate represent. It is the number of individuals who become ill among those exposed to the risk factor. Option C. Which of the following statement about screening test is correct? sensitivity and specificity are independent of disease prevalence. This is the correct one. Good health and well-being is the third goal in which international framework? Sustainable Developmental Goals. In direct method of standardization, which step is performed? Apply steady population rates to the standard population structure. In natural history of a disease, the stage in which pathological changes occur without symptom is known as subclinical stage. A disease is considered suitable for screening if there is an early detectable latent stage. The basic reproduction number indicates the average number of secondary cases produced by one primary case in a completely susceptible population. This is option B. In a multi-cluster sample with a design factor of 1.5 per stage for four stages, the overall design effect will be approximately, it is 1.5 into 1.5 into 1.5 into 1.5. Here the answer is option C. If the incidence among exposed is 20 by 100,000 per year and among unexposed is 5 by 1000 per year, the attributable risk among exposed is, the equation is incidence among exposed minus incidence among non-exposed by incidence among exposed. Here the answer is 75%. The vaccine carrier with properly conditioned ice pack can normally maintain the required temperature range of +2 to +8 degrees Celsius approximately 12 hours. Which combination of risk factors contribute most significantly to the global coronary heart disease burden? This is smoking and hypertension. Evaluation of a health program that focuses on implementation fidelity and immediate output is known as process evaluation. A region E with CBR, that is crude birth rate is 20 per thousand and total fertility rate 2.5 is likely to have, that is large population of women in the reproduction age group. Option C. Match the following type of cerebral palsy with their radiological finding. Spastic quadriplegia, it is periventricular leukomalacia. It is cystic encephalomalacia. Spastic diplegia is periventricular leukomalacia. Then spastic hemiplegia is porencephalic cyst. Chorioadenoid cerebral palsy is basal ganglia. So here A is option 4. Then B is option 3, C is option 1 and D is 2. Option A is the correct answer. Next, all of the following conditions are associated with congenital hydrocephalus except Rubinstein type B syndrome. Next, 17-hydroxylase deficiency is associated with which type of DSD? This is 46XY DSD. All are true regarding breast milk jaundice except it is conjugated hyperbilirubinemia. This is false. Which of the following situation in a newborn baby is least likely to be a sepsis and where the baby can be kept under observation? Upper respiratory infection in both baby and mother. All of the following conditions are associated with respiratory distress in a neonate on day 1 except congenital heart disease left to right shunt. Which is among the following is following statement regarding systemic onset juvenile immune arthritis is wrong? It is here option first one is wrong. Okay, this is wrong. Only one is wrong. Okay, next, small vessel vasculitis, medium vessel vasculitis. Okay, here answer is large vessel vasculitis is Takayasu Medium vessel is Kawasaki. Small vessel is HSP. Abnormal vessel in brain is Sturge-Weber syndrome. Here the answer is 2-1, option B, 2-1-4-3. Kwashiorkor is associated with all of the following features except voracious appetite. Causes of apparent regression in cerebral palsy can be new onset seizures, parental misconcepts, and new onset movement disorders. All of the above is the answer. Option D. In balanced translocation 21-21T, the risk of viable fetus to have Down syndrome is 100. The cutoff line for precocious puberty in a female child is 8 years. BCLS 2020 AHA guidelines include all of the following except option C. Preferred route of pharmacotherapy intravascular over intravenous. Usual agent for bioterrorism are all except it is Klebsiella and Staphylococcus. The following one is not a grievous heart. Emaciation. It is not a grievous heart. Davidson-Smith bodies are 78B. Davidson-Smith bodies in females. Ischial compartment socket is the prosthetic designed for transfemoral prosthesis. Piezoelectric crystal is a component of ultrasound. What is the most common site of tuberculosis in vertebra? This is paradiscal. Pirani classification for congenital Talipes equinovarus. Onion peel appearance is seen in Ewing sarcoma. Galeazzi fracture, it is the fracture of the middle third radius with distal radio-ulnar joint subluxation. There is a mnemonic that is Grimus. Grimus means Galeazzi. It is the radial fracture in the inferior. Okay. Then Mondegi fracture in the upper ulna. Grimus, that is S is superior. In malignant otitis externa, which of the following statements are correct except this? Infection may spread to the temporomandibular fossa. This is incorrect. Acute inflammation of laris produce hoarseness are all except laryngeal tuberculosis. Which of the following is not a feature of mucormycosis? Narrow septate hypha. Other all correct. Vascular invasion, it is correct. Black necrotic tissue, this is correct. May produce proptosis, correct. Here answer is option A. NPPCD, National Program for Prevention and Control of Deafness, was started by Ministry of Health and Family Welfare. It was a pilot project in which year? In 2006 to 2007. Which of the following statement is true regarding papilledema? Okay. Here, absence of spontaneous venous pulsation cannot be taken as a conclusive evidence of papilledema. This is true. Central visual acuity may be unimpaired in the initial stages. True. Then visual field change show enlargement of the blind spot. True. Tumors of the anterior canal fossa rarely produce papilledema. True. Here answer option D. Which of the following statement among is a false? Pneumococci can invade normal corneal epithelium. This is false. So here answer is option A. Which of the following statement is false? Primary angle closure glaucoma account for 50% of primary adult glaucoma in Asians. This is true. Phacolytic glaucoma is a type of secondary angle closure glaucoma. This is false. So option 2. Option B. Which among the following is true regarding cataract? Diabetic cataract is also called snowflake cataract. Correct. Christmas cataract is myotonic dystrophy. Hypermaturity generally does not occur in nuclear cataract. True. Low rate of posterior capsular opacification can be seen in those with hydrophobic acrylic lens after cataract surgery. Correct. Option D. 1, 2, 3. Correct. Then following laser is used for targeted phototherapy in vitiligo. Excimer laser. A 42-year-old man presented with multiple discrete flaccid vesicles and bullas on the trunk with oral ulcers and crusting of the scalp. Direct immunofluorescence of the perilesional skin lesion demonstrated IgG with a fishnet pattern and a linear banded dermoepidermal junction. The most likely diagnosis is paraneoplastic pemphigus. A 32-year-old female with multiple discrete hypopigmented patch with 5 in number with partly sharp borders and partly ill-defined borders on the anterior trunk. One patch has a satellite lesion. So this satellite lesion. So from this we can understand the answer is borderline tuberculoid. It is seen in borderline tuberculoid shows satellite lesion. The following are cutaneous manifestations of paraneoplastic syndrome except erythema chronicum migrans. Which is false about personality disorder in ICD-11? They're classified into categories. So this is a false statement. Option B. Wernicke's encephalopathy, which is true. It is seen in patients with alcohol dependence syndrome. True. It is associated with ophthalmoplegia and ataxia. True. It is managed with high dose of parenteral thiamine. True. All of the above. Option D. Regarding obstructive sleep apnea, which is false. In sleep apnea, we are not giving benzodiazepines as a treatment. So option C. Advanced directive. It is prepared by a person to specify how he or she does not wish to be treated for a mental illness. So option A is the correct answer. So this was the question paper discussion. പ്രാവശ്യം മെയിൻ ലിസ്റ്റിൽ വന്നപ്പം ലാസ്റ്റ് 47 സ്കോർ വരെയായിരുന്നു ഉണ്ടായിരുന്നത്. ഇപ്പം എന്തായാലും ആ റേഞ്ച് ആയിരിക്കില്ല, എന്താണെങ്കിലും കട്ട് ഓഫ് കുറച്ചുകൂടെ കൂടാനാണ് സാധ്യത. ഈ ഒരു ആൻസർ കീയിൽ എനിക്ക് ചെറിയ ഡൗട്ടുള്ളത് ഡേവിഡ്സൺ ബോഡീസിൻ്റെ ഒരു ക്വസ്റ്റ്യൻ ഇല്ല, അത് ചെറിയൊരു ഡൗട്ടുണ്ട്. അപ്പോൾ ഓൾ ദി ബെസ്റ്റ് ഗൈസ്.